may propagate. The minor additions are added in a very low quantity, like 0.001%. The inhibitors, they stop the or they prevent the initial instant propagation of the polymerization reaction, whereas the modifiers and opacifiers, they give different shades to the dental composite. One thing is important here, that the refractive index of the organic component, which is the polymer, and the inorganic component, which is the filler particle, the refractive indices of both these components must match with the tooth structure. Now let's talk about the mechanism of adhesion of dental composite with the tooth structure. As we all know that the bonding is of three types: chemical bonding, mechanical bonding, and micromechanical bonding. As the name tells, that the chemical bonding is through chemical means, whereas the mechanical bonding is achieved with the help of pins, screws, grooves, and holes inside the tooth, and it is only done in those cases in which maximum of the tooth structure is lost due to caries or during conservation procedure. The third type, which is micromechanical bonding, is only seen in dental composite, and this is achieved with the help of a specialized technique which is known as acid etch technique. The acid etch technique is a specialized technique in which first we condition the cavity. After conditioning, we treat it with 37% of phosphoric acid. After 30 seconds, we wash the phosphoric acid, and the tooth gives us a chalky white appearance. We use a low viscosity enamel or dentine bonding agent, and then we light cure it. After light curing the bonding agent, we insert the dental composite into the tooth cavity, and then if it is light cured dental composite, we cure it with light, or if it is a chemically cured dental composite, it will get cured by itself. Keep this thing in mind, that when we treated the tooth with 37% phosphoric acid, what exactly it did, it made microscopic holes inside the tooth structure. And when we added the bonding agent and light cured it, it formed resin tags. These resin tags were attached on one side inside those microscopic holes of the tooth structure, and on the other side these resin tags were attached to the dental composite, and that's how the micromechanical bonding is achieved in dental composites. Now let's talk about the advantages and disadvantages of dental composites. The most important advantage of dental composite is its aesthetics. It is the most aesthetically acceptable direct restorative material. It is available in different shades, and we can choose according to our requirement to restore the natural tooth structure. The second major advantage of dental composite is conservation of tooth structure. We don't need to cut the tooth to make a specific cavity design like we do it for dental amalgam. So the tooth structure is conserved, and that is a very big advantage that is achieved with dental composite. The third major advantage of dental composite is its repairability. If a dental composite restoration is broken, it can easily be repaired by another layer of dental composite. Dental composites have low coefficient of thermal expansion, and it is this property that the dental composite do not require any lining underneath the restoration. Now, talking about the disadvantages of dental composite, the first and major disadvantage of dental composite is polymerization shrinkage. As I told you, that one of the components is polymer, and when this polymer gets polymerized, and we know that whenever the polymerization reaction takes place, polymerization shrinkage is bound to occur. And due to this polymerization shrinkage, stresses may occur inside the restoration, and these stresses lead to debonding of the restoration from the tooth structure. Dental composites are technique sensitive, and they require a large amount of skill to do a very fine and well balanced dental composite restoration. Making the contact areas and proper contouring in the proximal areas is a very big difficulty faced while doing a dental composite restoration. Then the isolation is a major issue in dental composite. If the isolation is not proper, the composite and the tooth structure won't bind to each other even if the SEH technique is done properly. Another disadvantage of dental composites is non-antimicrobial effect. They do not stop the propagation of bacteria. That's why the chances of recurrent or rampant caries is more common in dental composite than any other restorative material.